Postpartum Care Introduction. Which of the following is true about your diet after delivery? Choose one of the following options. 1. The diet should be balanced. 2. The diet is not much different than the diet during pregnancy unless requested by the healthcare provider. 3. The diet should include plenty of water. 4. All of the above. Correct. Your diet after delivery will be similar to the diet you are on during pregnancy. It should be well balanced and include plenty of water. Talk to your healthcare provider about your diet and find out if he or she has any suggestions. The use of tampons after vaginal delivery may increase the chance of infection. Select true or false. Correct. Do not use tampons during your healing time after vaginal birth. It can increase your chances of infection. It is normal to pass some blood clots the size of a pea. Select true or false. Correct. Passing blood clots is normal as long as they are not too frequent or large. If the blood clots are bigger than golf balls, you should contact your healthcare provider. It is impossible to get pregnant before your period returns. Select true or false. Correct. You may ovulate before you get your period. You should use reliable birth control even if you have not yet had your period, if you do not want to get pregnant. Kegel exercises can help women with problems controlling their urine or bowel movements. Select true or false. Correct. Kegel exercises can help women with problems controlling their urine or bowel movements. These exercises strengthen the pelvic muscles and tissues that were stretched during delivery. There is nothing you can do to stop your breasts from leaking milk. Select true or false. Correct. Breasts will leak milk. Nursing pads can be worn to prevent milk from making your clothes wet. If you are breastfeeding, you should ask your healthcare provider before taking any over-the-counter medication. Select true or false. Correct. Some medications, including those available over-the-counter, may pass through the milk to your baby. Talk with your healthcare provider before taking any medication. You should contact your healthcare provider if you have the baby blues for more than a couple weeks. Select true or false. Correct. While emotional responses to a big life change like becoming a mother are normal, severe depression or depression that doesn't get better after a couple weeks should be brought up to your healthcare provider.
Thank you for using Explain.